All right, thanks, Austin. A new report from the American Lung Association shows Wisconsin continues to lag behind when it comes to tobacco prevention, despite decades of progress in smoke-free policies. Now, Crystal is here with us now. And Crystal, what is holding Wisconsin back?
Well, the report shows Wisconsin's biggest struggles aren't new, Dustin. They're tied to long-standing funding decisions and recent legislative battles. The State of Tobacco Control report points to chronic underfunding as one of Wisconsin's biggest weaknesses, including limited support for programs that help people quit and reduce tobacco use. Local immunologist and past chair of the Wisconsin American Lung Association, Dr. Todd Marr, says that problem dates back years to how the state handled money from the tobacco settlement.
Wisconsin, we got a tobacco settlement years ago, and our legislature spent it to balance the budget and didn't do what they should have done, which is put it aside for tobacco prevention and cessation.
Marr says even with funding challenges, Wisconsin has largely maintained its smoke-free air law, which has been in place since 2010, though that policy faced a significant challenge last year.
Both chambers of the House passed a law that would have allowed tobacco bars to be created in the state of Wisconsin, which is a kind of a loophole-ish type thing saying, hey, if a certain percentage of your income comes from tobacco, you're a tobacco bar. And so we're going to allow people to smoke here. A lot of partners worked with the governor to veto that, and it was vetoed, which is good.
The Lung Association says continued investment in prevention programs and protecting existing smoke-free policies will be key to reducing tobacco use in the state, as well as improving future report grades, Dustin.
All right, so Crystal, how does Wisconsin compare then to, say, Minnesota?
So they're both, kind of right along the middle there,
Okay.
but Minnesota does fare a little bit better, especially when it comes to the smoke-free protections, but say the prevention funding and tobacco policy still need improvement.
And what are some of those improvements then?
So in Wisconsin, that would be legal age to buy tobacco at 21. In Minnesota, they're really wanting the regulation of flavored nicotine products.
Okay, so some things to work on for both states. All right, thanks, Chris.